A ventricular assist device is an electromechanical device for assisting cardiac circulation, which is used either to partially or to completely replace the function of a failing heart. The function of a VOD differs from that of an artificial cardiac pacemaker in that a VOD pumps blood, whereas a pacemaker delivers electrical impulses to the heart muscle. Some VODs are for short-term use, typically for patients recovering from myocardial infarction and for patients recovering from cardiac surgery. Some are for long-term use, typically for patients with advanced heart failure. VODs are designed to assist either the right ventricle or the left ventricle, or to assist both ventricles. The type of VOD implanted depends on the type of underlying heart disease, and on the pulmonary arterial resistance, which determines the workload of the right ventricle. The left ventricular assist device is the most common device applied to a defective heart, but when the pulmonary arterial resistance is high, then a right ventricular assist device might be necessary to resolve the problem of cardiac circulation. If both an LVOD and an RVOD is needed, a BiVOD is normally used, rather than a separate LVOD and RVOD. Normally, the long-term VOD is used as a bridge to transplantation, keeping the patient alive, and in reasonably good condition, and able to await heart transplant outside of the hospital. Other bridges include bridge to candidacy, bridge to decision, and bridge to recovery. In some instances, VODs are also used as destination therapy. In this instance, the patient will not undergo a heart transplantation and will rely on the VOD for the remainder of his or her life. VODs are distinct from artificial hearts, which are designed to assume cardiac function, and generally require the removal of the patient's heart. The pumps used in VODs can be divided into two main categories: pulsatile pumps, which mimic the natural pulsing action of the heart, and continuous flow pumps. Pulsatile VODs use positive displacement pumps. In some pulsatile pumps, the volume occupied by blood varies during the pumping cycle. If the pump is contained inside the body, then a vent tube to the outside air is required. Continuous flow VODs are smaller and have proven to be more durable than pulsatile VODs. They normally use either a centrifugal pump or an axial flow pump. Both types have a central rotor containing permanent magnets. Controlled electric currents running through coils contained in the pump housing apply forces to the magnets, which in turn cause the rotors to spin. In the centrifugal pumps, the rotors are shaped to accelerate the blood circumferentially and thereby cause it to move toward the outer rim of the pump, whereas in the axial flow pumps the rotors are more or less cylindrical with blades that are helical, causing the blood to be accelerated in the direction of the rotor's axis.